that's the atria. The left atria is over here. Now this heart's kind of smashed in an odd way, but that's what we've got. Now this is the back of the heart. So you have the aorta, this opening here. The first arch vessel is right here. It's a little bit smaller. Right next to the aorta is the pulmonary trunk. Now how you can tell it's pulmonary trunk, if you put like a dull probe or a finger in it, and turn it around, it is very ventral. So it inserts in the ventricle of the heart, or sorry, very anterior, I guess. So it's very much in the front of the heart. The aorta goes like straight down the middle. So at the atria, you've got the hole for the superior vena cava here, and I think the inferior vena cava, I think that tissue kind of tore, but that would be right here. So there's the right atria. There's the left atria. Open the heart up. Okay, so this is the aorta. You follow that path down. You see the aortic semilunar valves. These little flaps right here. Now again, there's no strings there. The semilunar valves do not have the strings. Here's part of the semilunar valve as well. So that's the aorta. So you know this is the left ventricle. Very thick wall when you look here as opposed to the right ventricle right here. So the smaller chamber is the right ventricle. Interventricular septum is the large wall between. Now interventricular septum is thick as well because functionally it's really part of the left ventricle. The right ventricle just kind of hangs on the side there. So the chordae tendineae are the strings that attach to the AV valves, atrioventricular valves. Since this is the left ventricle, you know this is the bicuspid or mitral valve. And let's see, look at the other part of that heart. There's both flaps of the mitral valve. There's one flap here, and the other flap is like right here. And you see the chordae tendineae, the strings, and they attach to the papillary muscle. The papillary muscle is kind of a large, smooth mound, but it's part of the ventricular wall. Now, trabeculae carneae are, like if you look at the grooves and stuff way down in here, that's the trabeculae carneae. So don't confuse those with the papillary muscle. Papillary muscles get kind of smooth. But if the chordae tendineae attaches to it, you know it's papillary muscle.
Okay.
All right. I think that's really everything on the inside of the heart. Again, right ventricle, left ventricle, interventricular septum, chordae tendineae with the mitral or bicuspid valve, and then the right side, this is the tricuspid valve, so there's the chordae tendineae to that as well.